everyone. This is Natalie Garay, also known as the Pilates Mama, creator of Thera Happy Studios, and I am here live on this beautiful rainy day with Zabrina Cox, who I initially met through her sister-in-law, who's a client of mine, and Zabrina became a client of mine as well, and then turned into a friend, which usually happens with my clients because you can't not spend that much time with someone and learn all their intimate details without turning them into friends. So I consider Zabrina also a good friend, as well as her sister-in-law, Ginger. And so I'm happy to have her here to talk about motherhood and her work as an RN, a labor and delivery nurse, right? And doula, and who's recently created her own business called the Central Coast Birth Connection. Did I say that right?
Childbirth Connection.
Childbirth Connection, yes. So I'm so excited about that, and I'm so excited to chat with you about all the above, and love to hear your take and your explanation on your work. So please just introduce yourself, tell us about you and your family and your work.
Yeah, well, thanks, Natalie, for that beautiful introduction. And it's pretty easy to become friends with someone who calls you their sister, which I absolutely love. And it's very powerful. And I feel like just that little statement is a big part of like who you are and for the community. So I really appreciate.
Thank you.
Yes. So thanks for having me. So I am a labor and delivery nurse and 7 years. And I did a doula workshop, which brought me into a different part of doing labor and delivery and what I could kind of do better at the bedside. Mm-hmm. And then that kind of got me on the realm of childbirth education. So I also recently certified with Lamaze. So I'm a Lamaze and Kappa certified childbirth educator. And as well, kind of from all of that, I wanted to take my RN and childbirth education background and create a Facebook page for the community of mamas and families out there, updating them on events, kind of what's going on, evidence-based information, and just my thoughts from my professional background.
Yeah, and it's great. And I love that our community here on the Central Coast is such a warm and welcoming community, and such a just a warm and welcoming community. And we're all here to help each other. And you are so good at supporting people and giving and sharing people's events, but also offering information to moms and people in our community and bringing people together. And it's a true, and it's that's what our community is. It's what I feel like our community is. So you've just added to that, which is amazing, and even better that it supports moms because we need all the support we can get.
Yes.
So as a mom yourself, you have one son.
Yes, Joshua. He's going to be 2.5 next month.
Oh my goodness.
Yeah, a ball of energy. And I know some of the questions that will be kind of going through, it is definitely a challenging time right now.
Yeah. Oh yeah.
Yes.
So just from there, tell us about your experience, if you would, about being pregnant and delivering your own son, with having all the knowledge that you had as an RN and delivering other women's babies. How was that, and what is your perspective, and what were you nervous about it, knowing everything you know, and what were your thoughts and fears and excitements about all of that?
That's a lot.
In pieces.
Begin. Let's see. I definitely don't. Okay, so one of my biggest perspectives is having the knowledge that I had and kind of coming from the perspective, like as the nurse, okay, I know what to do in emergency situations. I kind of felt like I was supposed to have all the answers. Mm-hmm. And then teaching, you kind of feel like you need to have all the answers a little bit as well. And, or this, like, I know what book is going to be great for this situation. I know what information is going to be great for this situation. And when it came time for me, all of that went out the window because nothing was happening like I expected. Nothing was happening like I read.
Mm-hmm.
And quite the opposite. And so I feel like from my experience, I've kind of really learned about letting go and being present. And that kind of has just brought up being mindful, and that there's no right or wrong way. It's what's right for you. And yeah, just learning to be more present, and also trusting women and their bodies and what they are saying.
Mm-hmm.
And I get that too, like as the nurse, there's certain things that you can kind of start seeing when, okay, it's going to be time to start pushing or whatnot. So definitely educating yourself as much as you can, but there's a huge part of like intuition
Yep.
and knowledge that people can't take away from you. And so I was really thankful to have that part of like, I know my birth options. I know how to do research. I know how to educate myself, and nobody could really take that away from me.
Mm-hmm.
But I want to do, I have an upcoming mindfulness workshop for moms, because through it, what I want to teach women now, which I felt like I didn't really give myself that time, is to be mindful, to be present, to meditate, to feel comfortable with who I am. And it's kind of coming into just kind of going through the stages with a toddler right now, and family dynamics, or work, or family and relationship, how to balance, and how to like, get through an emotional shakeup. And so,
Yeah.
those are kind of my thoughts on my birth experience.
That's so good. And like you said, it progresses. Like, so you learned what you learned in nursing school, and that's what you had to go on. You had the information, you knew how to support women, you knew how to get things done in the delivery room, and you knew what they needed from that standpoint, from that learning experience. Then you added your doula learning experience, which is adding on, in my mind, more of, like you said, the intuition and the support and the guidance, and helping be a woman's advocate, basically, who sometimes isn't her own, or she is educated enough to be her own advocate, but also still wants that extra support there, which I think is amazing. Because had I known what I know now back when I was delivering, my experiences would have been totally different, of course. But so you're learning as you're growing and learning as you're doing. Then you had your own baby, and that probably shook things up a little bit too, changed your ideas, which also probably gave you a bigger, like you said, ear and heart for your patients.
Yeah.
And for your work. Because I know, like, you as a doula, you're supporting your sister-in-law the second time now, and maybe some girlfriends. So that's got to add an extra bit of heart to the whole experience.
Yeah.
So, so I love that. And just like you said, learning from your own life, taking care of a toddler, managing your home, your work, your relationship with your partner, all of that takes extra practices and learning and growth experiences to manage it all. And not lose your shit, and just be the best, most supportive and grounded mom and wife you can be.
Yeah. And right, that kind of goes on like growing that village, not being afraid to ask, and teaching women how to ask, because it's hard. It's hard to ask help, and especially being in a community or society that, praises the biggest and best, superhero, and, who could be the next super mom, or who can be perfect. And it's, so support, and asking for that is
totally. The
I
asking part is hard.
I don't have all the answers.
No, we don't. I know. And I was talking about this with the client, earlier, how that saying that it does take a village, it totally does take a village. And back to, the times where, Indigenous people actually did use their village to support each other, and still do, I'm sure. we really need that. So building our circles, building our tribe, whoever that is, whether it's in the delivery room or outside the delivery room, once we get home, and then afterwards too, finding our community to support us through each phase of childbirth or childhood and motherhood.
Yeah.
So important. I love it. So you mentioned you created the Central Coast Childbirth Connection to just build that community, basically, right? To support women, to give them the knowledge that they can have and build community.
Yes, definitely. And also the other part of it is connecting with professionals and know that, we are the village for everybody, and somebody might need Pilates, somebody might need a doula, somebody might need a chiropractor, somebody, might want to birth in a hospital, somebody might want to birth in a birth center. And so there's just so many options out there, and coming together as professionals to support these women, expecting and giving birth. So, yeah.
Yeah, absolutely. Sorry to mute you there for a second because Luna's down there losing her noodle. And because Ava just got home and she's knocking on the door, and I totally forgot to tell her that or leave it open for her, but she's got her key, so she'll be fine. Motherhood, and
yes.
we roll with it.
Baby, and I have a toddler that could wake up from his nap.
Yes. Anytime. Bring him in. We'll interview him too. And so now she didn't get my text message that I'm on a call, so now she's hollering at me. So we'll see how this goes.
Sounds good.
Okay. So tell me a little bit about your mindfulness workshop that you're working with. You just connected with somebody else in our community, and you're co-hosting a workshop.
Yeah. So again, I shared somebody's information. She had an amazing quote, and I shared it on my website, and one thing kind of led to another, and I told her about my idea, and she has over 30 years of experience. Dee DeJoya, she created Mindful, Kindful University, and super creative, and just one thing led to another, and she's super passionate about what she does, and I have a lot to learn from her in the business aspect of it. But yeah, so taking her experience and working from kids to adults with about mindfulness, and taking parts of the childbirth education and mixing it together to make something work for the physical and emotional challenges of pregnancy, childbirth, labor, and parenting.
Yeah.
And teaching people those tools and practicing them, and just creating that safe, non-judgmental environment for people to do so. So a lot of hands-on. Yeah.
That's awesome. I love it. I'm super stoked for you. And it's something that I focus on too with my work, because what I've noticed, these are the tools that I've used to heal my body and my emotions and my mind after having my girls. And so because what I noticed was when we are pregnant, we have so much information available to us, given to us on how to take care of ourselves and take care of the baby. But when it comes to having the baby and then going home, and our postpartum health, physical and emotional, there's not as much information available out there. So, and that's why I focus on healing the physical and the emotional. And one of the 4 pillars to my method, the Natalie Garay method, is mindfulness. So journaling practices, meditation, as well as healing the physical, which is Pilates, and then flower essence is healing the emotional. Oh, there you are. So I think that's so great that you're offering just another tool for women to be able to take care of themselves, because what I've heard from so many of my clients is, I I just don't feel like myself anymore. I'm so tired all the time, or I've got this brain fog, or, then we've got baby blues, or is it postpartum depression?
Like a lot of self-doubt.
Say it again.
A lot of self-doubt.
A lot of self-doubt. Yeah. All of it. Just, am I really made for this role? I can't be a mother. I don't have, I don't have the energy. I don't know what I'm doing. A lot of worthiness stuff comes up. So it's a lot going on for moms, that the more tools that we have, the better. So I think that's super cool.
Yeah, no, definitely. And that's what, going back to what's happening in the labor rooms. I just posted something on on my hospital group, and there was an article that just came out that the WHO, World Health Organization, put out about intrapartum policies and practices on how to create positive birth experiences, because what happens in that room in that amount of time, and studies have shown from Penny Simpkins saying that 20 years later, you're going to remember what happened at birth. And we have the power to create women who feel strong and confident. And we also have the power to make them feel self-doubt, anxiety, worry. And we each kind of play a part in women's lives as professionals. And so I truly feel like it's an honor and a privilege, and, to be a part of the community, like you said, as an advocate, to keep learning on how we can best, provide care to women.
Yeah, because the more that they go in empowered and being able to make empowered decisions, whether, let's say, for example, a woman has a birth plan to deliver vaginally and she does not want to have an epidural. But things shift, and possibly she doesn't end up with a vaginal delivery, but she ends up with a C-section. So being able to have that information at hand, whether she's learned it beforehand or whether it's something that you give her, she's able to make an empowered decision, so that afterwards she has no regret or remorse about how things happened in the delivery room, or how her baby came to be in the world. Because I do have clients, and I have heard stories about women who's, they have a lot of sadness about their birth experience, and they have a lot of sometimes shame around their birth experience, or they feel guilty about their birth experience. Also, some feelings of their body not doing what it's supposed to do.
Yeah.
So I think your role is super important in helping women feel, supported in their decisions, and supported in, even if it isn't their decision, the birth plan takes a different turn, just being able to tell them this is okay, this is going to be okay, and just supporting in that role. Do you have experience with supporting women through that, or seeing shifts in birth plans?
Well, a shift from, what do you mean?
Like if they are set coming in and they know they're going to have a vaginal delivery, no epidural, and emergency C-section happens, or something along those lines.
Yes. Okay. So yeah, I can think of one story off the top of my head is like a long induction.
Yeah.
So a patient that had a long induction and was trying everything and really, really wanted to avoid a cesarean. Mm-hmm. And, sometimes it's just listening to them and telling them they have permission to let go. And, it's their own unique birth story, and we're as unique as our own birth stories. Mm-hmm. And, that to let go of that control. And I'm a really big quote person, and I try to, in with my clients and at the bedside, to bring, powerful quotes to just kind of remind people that, you know, they have that strength and that they feel safe and, you know, and loved.
Yeah.
And just kind of like educating them, about that mind and body connection.
Yeah, it's huge. It's huge because it does take a toll on the body and the mind afterwards. And the healing process can be slower, you know, when things don't go as planned and women are feeling a little bit emotionally attached to it. And from what I've seen in my work, other things come about, other things manifest in the body physically when we hold on to a lot of our pains and, you know, shame or guilt or anything. So I think, like you said, it all kind of stems from that birth experience. It can be happening right there in the hospital.
Yeah, no, definitely. And I mean, so positive birth experience, creating that means that they're, you know, women are involved in their care, they're trusted, they're respected. And sometimes with birth plans, you know, somebody might write on there, oh, I don't want an IV. Well, making just a simple explanation and giving them that, you know, making informed consent and informed refusal. You know, if somebody was just saying, okay, this cesarean's medically necessary, or, you know, this is what would happen in this situation, just explaining to women and not thinking that we have control over their bodies can definitely change people's birth plans and say, okay, and having like an open discussion. So something as simple as that, you know, I'll never forget this one doctor. This one woman pushed for like almost 3 hours, and she gave it her all. And for whatever reason, I think the baby was, you know, sunny side up. And so he came in and walked right between her legs and was like, so because you couldn't push the baby out, you have to have a cesarean.
Oh my gosh.
That happened in real life in probably the last 6 months. And those are powerful words.
Yeah.
And it just wanted to strangle the guy. It was a guy. And just like made me, what I was about to say after, like even more important, and like, you know, was there with her every minute. And there's just a lot of work to be done.
Yeah, there is. There really is. Just about teaching women what's available. This is so based on what when I had my twin daughters 15 years ago, I was 26 years old. In the last 5 years, I've learned so much just from being here on the Central Coast and being a part of the birth community. I've learned, you know, what options are available. You know, I probably could have delivered vaginally, even though they were twins. You know, I probably could have delivered my third daughter vaginally, even though I'd had a C-section. So we get people telling us what we can't do, what our bodies can't do, using scare tactics. I actually had one doctor that I was seeing tell me, I think it was 1 week before I delivered my third daughter, told me, no, I could not have a C-section, and then gave me every possible scenario that could happen. And here I am 9 months pregnant, so I'm huge and I'm emotional, and he scared the crap out of me. So I switched doctors 1 week before having Ava, and I had to go out and find a new doctor who would take me on 1 week to my delivery date and deliver Ava. And I ended up having a C-section anyway, but this second doctor's words made me more comfortable and confident to where I was able to put my trust in him and go, okay, you say I have to have a C-section. I'm okay with that now. But this jackhole who was trying to give me, you know, every possible scary scenario, but it was, and yes, I guess you have to inform patients of what could happen, but I'm sure, like you said, there's a way to say it.
Yeah.
So words are powerful, of course, and that's going to be carried. That will be carried with them for a long time.
Yeah. I mean, and so we haven't even gotten to the 20 years yet, but I mean, 13, 15 years later, you remember that experience.
Yeah. Oh, yeah. I ask women, I've interviewed several women, and even when I post on social media, I'm like, what is your birth story? Share with us what you remember, or, what are your concerns, or, and everyone's like, oh my gosh, my first one, blah, 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 blah. And then my second one. See, everybody remembers the whole thing. And yet we still have more. Just kidding.
Yeah.
We keep doing it.
I know. Yes. Yes.
So
that Pitocin hormone.
Yeah. Oh,
that love finds us. Gets us in trouble.
Yeah. So, okay, let's talk about you as a Pilates client. And you've used also some of my calming remedy, yes? Yeah. So
before the interview.
What did you say?
I did before the interview too.
You did? Oh, she's calm and grounded, everybody.
Yeah, I am. Live.
So funny. So I would love to hear your words and thoughts about what you were experiencing before Pilates, why you decided it was something that you wanted to try, and then just your experiences of working with me in Pilates and flower essences, and how they've helped you.
Yeah, definitely. Well, I should have gotten in sooner. Should have listened to Ginger and gotten in sooner. But yeah, definitely trying to find that balance. So I came into Pilates with lower back pain. And yeah, just being a nurse and a mom, and I was constantly doing baby wearing. I just had low back pain, really had pain everywhere. So, and from what I've always heard is, when I have better abdominal strength, then my back pain is lower. So, yeah, I went into it with low back pain, and I came out of it with so much more. And especially with like your growth and development, has gone beyond Pilates for me. So, yeah, I love our sessions. It feels like, a great, you're working out, but you're still laughing and getting advice. And yeah, I thought I should charge you for some business advice extra. But yeah,
you charge me for business advice, or I charge you for business advice?
Me for business advice. Put it on the tab. It came out so much more. And like you said, friendship. I mean, it's easy to be a friend. And so, yeah. Yeah,
I remember. I'm sorry, say it again.
Oh, no, I was just going to say the benefits, but go ahead.
Oh, I just remember you coming in saying, yes, you had low back pain which happens, we're pregnant, our bellies are stretched out, we've got baby, we're nursing, we're hunched over, and our backs take the brunt of it all when our abs are weak. But for you were also lifting and moving patients. So that was a big deal for you too. And standing on your feet for long hours, right? It's 12-hour shifts for you. Yeah. So I just remember, those were your main complaints of coming in, and but you're also really good about taking care of yourself and seeking acupuncture, support from acupuncture and massage too, which I think is phenomenal, because not a lot of women do that. I mean, it's hard sometimes for women to even make the decision to do Pilates, or exercise. And I say that, and as a mom of 3 and a solo mom of 3, I get the time constraints too. But sometimes it's just making that decision. And then when you make the decision of, I am going to go, things kind of fall into place, whether it's the need for childcare or convenience of location, whatever it is, they kind of fall into place once we make it a priority.
Yeah, totally. And that is, and I mean, I got the prescription from my chiropractor to come see you. So I was also seeing a chiropractor.
That's right. That's right.
I have to find this like prescription, because I totally believe in like that mind, body, and it's not just one piece that's going to be a cure all, at least not for me anyways. And so I just kind of was starting to find what was working. And what was I going to say? Oh yeah, I definitely feel like we as a society take better care of our cars ourselves. And, you know, what happens if you don't get an oil change? What happens if you don't fix a flat tire? I mean, it's not going to be usable. And luckily I married, you know, to somebody that totally believes in that too. And I mean, I can tell you, I went to the doctor one time, my actual primary one time last year. And, it has just wellness has just made a huge difference in my life. So.
Absolutely. I mean, you're getting more out of it, I think, more out of wellness than these checkup visits that we're supposed to have annually, or just going, you know, you're avoiding going for colds and getting antibiotics and things like that. So yeah, it's really important. And I was talking to another client earlier, like you said, if your car's not working, you're not going anywhere. Same for if mom's out of commission, nothing's happening. You know, basically everything is shut down, and there's not a lot.
And physically, you know? Yeah, it comes out, you know, in anger or frustration or constant pain. You know? I have a lot of friends who are, you know, in their 30s and are in constant pain. And,
and it's hard to mother from those points, you know, because we all strive to be the most patient, most kind and helpful and available and present moms. But when you've got like back pain nagging at you, whether you're conscious of it or not, it's there, and you get irritable, and you've got this irritability about you where it's hard to focus, hard to be present, and you're probably snapping at some of the smaller things because that's just how you feel at the moment.
Yeah.
Same with whether it's your kids or your partners. And if you're feeling not strong or energized, it's hard to be, again, available for your kids if you want to be playful or pick them up or, you know, things like that. So yeah, I'm obviously a huge advocate for taking care of yourself and your body before everything falls apart.
Yes. I'm going to, can we press pause? Because my phone is going to die.
Oh, yeah. Let's pause and then
wrap it up.
Okay. So if you had thoughts or suggestions for moms, whether they're new moms or even later in life. So my big thing is, you know, I say postpartum rehabilitation, and I think in most minds, postpartum, and maybe there's an actual definition that postpartum is like 6 to 12 weeks or something. But in my mind, postpartum is anybody who's had a child, because most women have never rehabilitated after having a child because they didn't know, for one. I mean, most women don't realize that you do need to rehabilitate, whether it's for not experiencing back pain, or if you've had a cesarean section, and that's a major abdominal surgery, that definitely needs to be rehabilitated. But also the emotional piece of it too, which a lot of people forget. So to me, it's anybody who's had a child, whether they're 25 years old or the kid's 25 years old or 40 years old. To me, postpartum rehabilitation is any woman who's had a child.
Yeah, I like that.
Yeah. So
it's true.
it is. I've had women in my workshops who are like, you know, they'll message me beforehand and say, my kids are long gone and grown. I'm a grandmother. Is this class for me? And I'll say, absolutely, because most likely you're either experiencing incontinence or you've had a mesh surgery for incontinence with organ prolapse, because a lot of women that age are experiencing it, aren't talking about it because it's not it's not a subject you would talk about especially at that age, I feel like they're a little bit more modest and a little bit more to themselves.
Mm-hmm.
And for our age, we just talk vaginas and incontinence all day long.
Yes.
So, and our work. So anyway, if you were to share any tidbits or thoughts or just insight that you have from being a doula, RN, or as a mama, what would you share?
For the postpartum rehabilitation, I would definitely say that give yourself permission to take care of yourself.
Yeah.
For many reasons. Yeah, I mean, a mindful practice is self-care, and that's number one. And if you can't take care of yourself, you can't take care of anybody else. And I mean, you might physically be able to make dinner and do laundry and, cook food, but emotionally being there, I feel like is so important for relationships and connections with your partner, with your children, and most importantly, again, yourself, having a relationship with yourself, and practicing. So that's one thing, is it's okay to take care of you.
Yeah.
And put yourself first. And then the other thing I would share too is what's worked for me is, waking up and reading a quote. And so a lot of like positive self-talk, if you're going to be having a baby, birth affirmations, any kind of positive affirmations. And I was so happy that you shared on your 12 days of Christmas that Sarah Love person and that calendar, and just reading something every day. So she has an app that, gives you a beautiful message. And for me, journaling, it's hard for me to open a book and write down. And so this is kind of an alternative where the message pops up. You can set a timer whenever it comes, and then just write whatever you want. And another good book that I just read was called it's Nurture by a doula, and she founded this awesome childbirth hub in LA. But anyway, she just wrote a book called Nurture, and everything pregnancy and birth and postpartum related. But she just said that journaling, it's okay if you just write one word. And that was like powerful for me, because I really think on the app, like I wrote one word because that's all I had energy for. But I did it. I got on there and just wrote one word, and she just gave some good tips. So I'm really looking forward to your workshop, because that, is just practicing that mindfulness, and that self-care is really huge. And
it's huge. Therapy on Sunday. It's going to be awesome. And journaling is a practice, like I said, I've been using for years. And I was on another call, I was reminded I've actually been journaling since high school, but again, took it up about 5 years ago after reading The Artist's Way. And she talks about morning pages and basically just doing a jot down for 5-10 minutes, whatever it is. And like you said, sometimes it's just a word. For me, sometimes it's just a sentence. Sometimes it's just, I don't know what I'm doing, or whatever comes up. Sometimes we wake up and we've got a lot going on in our mind coming out of dreams or whatever. And maybe we're feeling a little bit down, but as soon as you let it go and write it, it's just such a relief. Sometimes it's affirmations, and sometimes it's a list of what my day looks like. It could be anything, but it's getting it out of the head and onto the paper is what is uplifting and kind of a relief and a release. It's also a direct connection to any guides that you have around you. So if you're writing down, especially affirmations or needs or wants, things like that, it's a direct connection and communication to, your guides, which is even more powerful.
Yeah.
So I'm looking forward to it. It'll be great. And anytime you can do any prompted journaling, it's even more fun. So that's what we're going to do.
Yeah.
So, okay. So if you were, well, we kind of discussed, I'm looking at my list of cues here. If you were to describe the Natalie Garay method, so the Natalie Garay method, as you know, is the 4 pillars being Pilates and flower essences and mindfulness and community. And those 4 things I've combined because those are the things that throughout my work, throughout my life as a mom, 15 years, and then as a Pilates instructor working with women over the last 13 years, it's the way that I've basically been able to strengthen myself. So what words would you use, just if you were to list like 3 words, what would you use to describe it?
Love.
I love that one.
Yeah, that all sounds loving.
Those are 2 good ones. I'll take those. I love it.
Love and loving.
Love and love and love. I love love.
Yes, love, love, love.
Love is my favorite. Valentine's Day is my favorite.
Yes.
Well, thank you so much, Zabrina. I'm so grateful that you took the time to sit and chat with us and to so openly share your experience and your wisdom. And like I said, I'm so excited for you and your new adventures. And I can't wait to see where it goes from there. And I'm just so grateful to have you in my tribe, in my community. And so thank you.
Yeah, thank you for having me and for asking these questions. And it's so important. And again, just another way for supporting women, and super proud of you. And, just in the short time, you've done amazing things, and look forward to more of it. More love.
More love. To more love.
More love.
Thank you, my friends. Yes. All right. I will see you later.
Okay. See you soon.
Bye.
Bye.